What I'm going to be talking about today, I don't know how familiar you are with the work that DataNB does. I assume a little bit, but we have a research agreement with Postsecondary Education, Training, and Labor, and one of the things that they are very interested in is around the recruitment and retention of people in occupations that are in short supply. So this work that I'm going to present today is in partnership with the Department of Health. We work closely with them on regulated data, also some of the regulatory authorities, but PEDAL is the funder of this research. In the interest of time, I only have 30 minutes or so. I am going to just focus on two occupations: registered nurses and social workers. The registered nurses report, the results here are drawn from a report that's already on our website. You can please have a look at that. The social worker retention report will be coming out soon. It's just in translation now. And then we are currently underway with the paramedics. And I'll talk about at the end some of where we're going with this approach. And I'll just also say that this is unique in Canada. No other research data center, provincial data center in Canada is doing the kind of work in terms of linking of registration, occupational registration data with education data and Medicare data. So that's what I'm going to be talking about today. And I'm just going to motivate why this is important. And you can see in the little graphic there, this is from Immigration, Refugee, and Citizenship Canada, that we have many occupations that are in short supply. So that's no surprise to anyone in New Brunswick with shortages of registered nurses and many other occupations. And so this is the work that we're doing is directly relevant to federal immigration policy because IRCC, in an attempt to kind of help meet the shortage, is actually opening up specific pathways if you happen to be in one of these occupations. So skill mismatch is an ongoing issue. We have current, future shortages. We know the population's aging. And so all those issues together put the retention, the recruitment and retention of people in health-related and other occupations front and center in terms of both federal and provincial policy. One of the big challenges in understanding all this work, though, is that in Canada, unlike some other countries such as Germany, we actually don't have much in the way of systematically collected data on occupation. So there is the census that is a self-reported occupation, and lots of people have made use of that, but it's only every 5 years. It's self-reported, and it's a point in time, so it's not linked with anything else. There's the labor force surveys that Statistics Canada collects. There's self-reported occupation there, but those are a pretty small sample, especially if you're interested in things to do with smaller provinces like New Brunswick. There's also administrative data from workers' comp claims. So if you file a workers' compensation claim, you use occupation there, but that's a very selected sample in terms of occupation. So systematically, we just do not have much in the way of insights into the occupations that people are in. In tax data, when you file your taxes, they ask you your industry of employment, so we can get industry, but that's not occupation. And that sets us up for what our approach is. And this is the recognition that there are certain occupations where you need to be certified or registered in order to practice in that occupation. So that then becomes an opportunity for us to have a view into who's in an occupation. If you're in one of these regulated occupations, then you have to register. You have to be registered, and that registration data then becomes a source of data that we can then use to try and fill in that piece about, well, we're attracting immigrants with certain skills. We're training people coming out of nursing programs or social work programs or whatever they are. Are they staying in New Brunswick? But more importantly, are they working in their field of training? And so the idea of a regulated occupation gives us that opportunity. So what are regulated occupations? These are professions and skilled trades that are overseen by a regulatory body. You require a license or certification or registration to practice. So they do lots of things. They investigate complaints. They're concerned with educational standards. They ensure competence through training. And the part that we're most interested in is they issue licenses to practice. So if you cannot just call yourself a social worker, you can't just call yourself a physician or a nurse practitioner or LPN. There's many occupations, and I'll give you the list of them in just a second. As I am actually an economist, economists are not a regulated occupation, so anybody can call themselves an economist if they want to. So most of the occupations in the health sector are regulated occupations. So this includes dentists, dental hygienists, optometrists, RNs, LPNs, physicians, paramedics, pharmacists, social workers. So there's a long list of those. And if it's a regulated occupation, it means you need to be registered and your credentials are evaluated, and they will certify you as meeting the requirements to practice and call yourself one of those. And the little graphic there I have is from Saskatchewan. And you can see that this is a very competitive area, that it's not just competition to try and attract immigrants and get people into our programs in New Brunswick. but provinces are all facing these shortages, and they're trying to poach people from each other, from other provinces. So this is, I just took this from the internet. You can get this. This is showing up in New Brunswick. If you're in one of these occupations, come to Saskatchewan. So there's some pretty aggressive recruitment, and we also do some work, just as an aside, on teacher retention. I have friends who are teachers, and they say that the students coming out of the BED, they're actually being their approach coming right out of BD saying, come to BC, we're going to offer you a B contract. So this is a very competitive market in terms of trying to attract these regulated people in these regulated occupations. So we think about where our composition, where does our workforce come from? And this little graphic helps to illustrate what the potential sources are. And it's also going to set us up to look at what those key decision points are that we're going to focus on in the work. So you can think about our workforce at any given time. You can be from New Brunswick, you go to school in New Brunswick, you go to post-secondary in New Brunswick, you go into the workforce in New Brunswick. Sometimes you're from New Brunswick, you go to school in New Brunswick and you leave, but there's a pathway into the workforce. You can move here from other provinces, either as a child or as an adult. You can come here for school, you can come here for university or college, and then you can enter the workforce, or you can enter into the workforce directly. So we are trying actively to recruit people in these occupations from other provinces. You can also come from other countries. You can arrive as a child, as an immigrant. You can come here for school, or you can go through one of the various immigration pathways through either temporary residence or permanent residence and into the workforce that way. So that makes up the composition of what our current workforce is. And so what we're going to focus on, and we're going to in this work, we're limiting it to people who are primarily people who are educated in New Brunswick. So the investment that the province is making in subsidizing the costs for training social workers and teachers and nurses and physicians and all these other occupations, whether through a university or community college, we are interested in what they're doing. And in terms of, are they actually going to be in our workforce in New Brunswick? There are a number of points of decision that we want to look at. And so all the work on around immigrant recruitment and retention, that's in separate work. We published lots of work on that. I can direct you to that later on if you're interested. So for this part, we're just looking at domestically educated. So there's the first thing. If you finish a program in New Brunswick, what affects your decision to move into that occupation in New Brunswick? So if you're trained as a social worker, are you going to work as a social worker in New Brunswick? The second one is, okay, suppose you do, how long are you staying here? So retention is critical because we can put a lot of effort into attracting you, but if you're not going to stay, then that means we're going to have shortages in the workforce. So we want to look at factors associated with the retention of people in that occupation. And the third one is what we're calling geographic retention. So if you leave a particular occupation, and if you are less than retirement age, are you still in the province or not? If you're still in the province, then potentially we could get you back into that occupation. So at least you're geographically present. And so if you're looking at changing careers, we can potentially bring you back. If you're not in the province anymore, it's going to be a lot harder. So the third dimension we're looking at is, if you do leave, where are you? Are you potentially available to bring you back into the workforce? So those are the three dimensions that we're going to look at. And the data we use here, so if you've seen other presentations using administrative data, I know that Sandra Magalis has presented a few times. We have graduation data from universities and community colleges in New Brunswick. These are the public institutions. We're working on data sharing agreements with the private sector, but right now it's public institutions. We have regulatory data from social workers, from the paramedics, and registered nurses. So these are data that come from the regulatory authorities through data sharing agreements with our authority to do this as a data custodian. For some occupations, we have payroll data. So if you're employed and paid by the province, then this can be another view into whether you're working in that occupation or not. So the work on registered nurses that I'm going to present is a subset of RNs who are working in the health authority, so working in the tertiary or working in the public sector. So payroll data will tell us, are you actually employed? And this is another view into this. So we have that for teachers and for RNs and LPNs. And then we link it to Medicare information. So your Medicare, our citizen database, which will tell us, do you have active Medicare? Are you still in the province where you're living? And that tells us place of residence. And there's other work going on that is actually because these data sets are all linkable, that we can connect an individual's registration. So we know you're working as a nurse, say, with your health records and see what are the factors associated with health and wellness of the workforce and its connection to burnout, exit the workforce early retirement, or whatever that is. So that's other work that's ongoing, but that's what's enabled by having linkable data. So I'm going to first take you through a fair number of descriptive statistics on registered nurses. And so what's structuring this is just, we're trying to give some insights into those three key decisions. If you finish school here, do you move into employment in that occupation here? If you do move into an employment in that occupation, how long do you stay? And if you do leave, where you stay, where do you live? So just for RNs in the public system, we look at where you were before you went to school before you graduated with a nursing degree in New Brunswick. So if we look at the RNs currently in the public system by place of previous residence, about 2/3 are from New Brunswick. So that means that they were from New Brunswick when they went to the nursing program in one of the nursing programs in New Brunswick, and then they're still here. A smaller number come from other provinces in the Maritimes. And then you can see in the scale goes up here that around 20% come from other places. We've grouped together other provinces outside the Maritimes, international because of small counts, but these are mostly international. These are people who are working, who are permanent residents or temporary residents who are working as a nurse. And you can see that number is increasing. So the overall number of nurses, which is the width of the bar, is increasing. It's not actually keeping up with our aging population, but it is increasing. But there's an increasing share of the nurses who are currently working who are coming from other places outside of New Brunswick and the Maritimes, mainly overseas. If we look at if you finish a bachelor nursing program in New Brunswick, what happens to you? Where do you move into employment in nursing? And we can say that anytime post-graduation, around 90% of the BN graduates in New Brunswick are working as an RN at some point, and around 10% aren't. And you can see the numbers, the number of bachelor's BN graduates is fluctuating from year to year, but the vast majority of them who come through our programs are working as an RN. When we break that down by where you're from, almost all of the nursing graduates who come from New Brunswick, who are residents of New Brunswick, they go into a nursing program in New Brunswick, they stay in New Brunswick. But if you come here for school, if you're from out of province, around 80% of you move into nursing. But if you're an international graduate who comes through the BN program here, only around 1/3 of you are staying and working as a nurse in the province at any point. We look at attrition by age. You can see that this is structured so we look at years from 2016 to 2022. Not surprisingly at all that there's an increasing gradient by age. If you're 55, 64, you're much more likely to leave, 65 plus. But what's interesting is that there's been a change over those years. That in the more recent years, 2021, 2022, we see that for the younger cohorts, so young nurses and nurses 25 to 34, that more of them are leaving. So around 20, the way to interpret this is among the nurses who are working as an RN who are aged 25 to 34 in 2021, around 6% of them left nursing that year. So you can see that those numbers are going up. And at the same time, across all these ages, but at the same time, the older nurses, their exit is going down. And this is possibly in reflecting that we have shortages. They're being enticed to maybe delay or defer that retirement decision. So the exit of nurses, although higher than younger ages, is going down. So if you compare the attrition rate for nurses for 65 plus, it's almost 30% per year. By 2022, it's less than 10%. So the composition of our nursing workforce is changing. And if we're enticing more of the older nurses to stay, then that is a short-term solution because they are going to retire eventually. Now this graph looks at, okay, the retention. Suppose you start as a nurse, an RN in the public system. After 1 year, around a low 90% are still here. So that means of those, this is not an attrition rate. This is of the nurses who start after year 1 in 2021, 9% of you have already left. After 3 years, almost 20% of you have already left. And after 5 years, almost a quarter of you have already left. So this is not surprising in terms of the decreasing numbers. But what that means is that of those nurses who come into the program and are working as nurses, 5 years later, a quarter of them are gone. They're not necessarily left the province, but they are not in the public sector. Now, maybe they've gone into other sectors of nursing. So they're working in special care homes or they're working in private practice. That's what the work that's ongoing now, where we have the full registration data of RNs from the association. If you do leave nursing, where are you? And we can see, and this is not surprising, that if you left when you were 60 plus, you're here, you're in New Brunswick. So basically, if you're retiring from nursing, your family's here, your house is here, your social networks are here, you're not going to leave. But if you are young and you leave the nursing profession, then after 5 years, half of you have also left the province. So you leave nursing, but you also leave the province. So that's a pretty high attrition rate. That means that it's going to be a lot harder to try and entice you back to work in New Brunswick. Those are descriptive statistics. We also do some statistical analysis, econometric work, where we estimate what's PHM is proportional hazard model. It's a duration. It's a method of looking at factors associated with duration. And so the way to interpret this is that a hazard ratio that's greater than 1 means you are more likely to leave nursing. So this sort of confirms our descriptive statistics that other things equal. That's what the regression analysis does. It says, let's hold everything else constant and isolate the effect of these factors. If you are not from New Brunswick, you have about 50% greater odds of leaving than if you are from New Brunswick. If you're single, you're much more likely to leave. If you're young, once we control for everything, you're less likely to leave. And also job status makes a big difference. And this is not surprising, but it also suggests that this full-time nursing status is associated with greater retention of nurses. And then we look at if you're working in the Horizon Health Authority, if you're in Vitalité, other things equal, you're less likely to leave. If you're in the Moncton area, you're more likely to leave. So this is just regression analysis. We go into a lot more detail about this in the report that's online. So now I'm going to switch gears and I'm going to go through similar kinds of statistics for social workers. This report is not available yet, but it will be available soon. And this is all registered social workers in the province. And we work closely with the New Brunswick Association of Social Workers. They've given us permission to use their data. They're part of the project development. They're also going to review all the results before they're made public. So this is looking at, and we're looking at BSWs. And so UNB has introduced a social work program. We don't have the data on that yet. There's also social work technicians. We don't have the data on that yet. Those will be coming out in the next iteration of this report. So among those social work graduates in the University of Moncton and St. Thomas, how many of them registered as a social worker within 1 year of graduation? And you can see that the numbers are significantly different from the RNs. So this number in 2022 is a little bit less because we don't have a full year of graduation there. We only see till the summer. So any fall graduates, they're not here. So this is a limitation of the data for 2022, but the other ones should be complete. So what this says is that in 2021, if you graduated from a social work program, only 70% of you moved into social work within 1 year of graduation, and a third of you didn't. And the numbers fluctuate a lot. We're actually doing a lot better in terms of retention than we did in the early 2010s, where 2/3 of people who graduated from a social work program in 2010 did not register in the first year. And this would partly reflect where you're from, and would partly reflect those factors associated with engaging between the programs and employment and trying to facilitate those pathways into employment. Where you are from matters, and this graph illustrates that. So we look at who is newly registered as a social worker in New Brunswick, and we look at where you're from. So if you came from a New Brunswick school, this is of the social workers who registered in a given year. So new registrations in 2023, and again, 2024 is only a partial year. We see that only 2/3 of the newly registered social workers come from New Brunswick. A third come from other places, either international or other provinces. This is significant reliance on an external workforce to meet our social work needs. And so expanding one of the interesting policy questions is we expand social work seats, BSW seats in the province. Are we going to actually decrease the reliance on other sources and be able to meet more of those needs from our domestic, kind of our local students, local graduates? If you did not register as a social worker, so you were registered, and we look at the point at which you cease to be registered. And so if you didn't register, it means you are not permitted to work as a social worker. You can still be doing work that's related to social work, but you can't be working as a social worker. So among those people who stopped being registered, where were you? So sorry, let me rephrase. This is people who graduated from the program, looking 3 years after graduation, who did not register as a social worker. So you graduated from a New Brunswick program, you're living in New Brunswick, and after 3 years later, did you register? If you didn't register, where are you? And so we can see that of those people who graduated from a program and did not register as a social worker, where are you? What are you doing? And only less than a third are still in the province, and 70% have left. So if you're not registering in that first couple of years, you're not only not working as a social worker in New Brunswick, you're not in New Brunswick at all. So you're just gone. We look at attrition rates. So this would be the rate at which social workers who are registered stop being registered. You can see that there's a fair bit of fluctuation, but we see similar patterns to what we saw for the nurses, that over the more recent years, the attrition rates over time have increased for the younger workers. So if you compare 2020 to 2022 or 2023, To look at the height of this, say the gray bar says that it's attrition's pretty low. A little more than 2% of social workers in their 30s have let leave in a given year. By 2023, it's doubled. It's more than 4%. Same thing for the social workers in their 50s. Same for the social workers in their 20s. So if you're a younger social worker, your exit from employment as a social worker is increasing through these years. Now, these are the post-COVID years. We know things were very stressful there, and we're seeing the effects of it. But at the same time, and similar to nurses, that the retention or the re-registration of the older social workers 50 plus is actually going down. So for various, whether it's policy or personal decisions, they're less likely to leave. So our workforce of social workers at any given time is starting to look a little bit older. And that also means for longer term, we're going to have issues. We look at rates of attrition by where you're working. So you can see there's some variation there. If you're a social worker who works for the government of Canada, around 9% are leaving in a given year. If you're working for a regional health authority, 3%. Some of these are based on some pretty small numbers. So now we're looking at retention, and I only have a few more slides. I'm going to aim to finish at 2 o'clock. Is that right, Pam? 2-ish?
We're good until 2:20. So if you did want to cover a little bit.
Okay. So yeah, I'll try and leave, say, 15 minutes for questions, discussion. Okay.
Sure, that's good.
Okay, so what we're looking at here is if you've registered as a social worker, so you're new in the practice, how long do you stay around? So what is the retention rate? This is not the exit rate. This is not an attrition rate. A attrition rate is of everyone who's working, what percent stop working in that field? This is if you just started, you're new in the profession, you just registered in New Brunswick, how long do you stick around? And you can see that the retention rate for 1 year in the more recent years is around low 90s, 90%. So in 1 year, we're losing about 10% of those newly registered. What that means is that they register in year 1, year 2, 10% of them have no longer registered. They've ceased registration. They might be doing something else. They might be living in New Brunswick, working somewhere else, or they might be gone, but they're not registered as social workers, which means they can't practice as social workers. 3-year retention rates are a little less than 90%, and 5-year retention rates are around 60%. So what that says is, and we're only looking at 2019 because we need that 5-year look forward window, is that after 5 years of newly registering, around 40% of those newly registered social workers are no longer registered. They are not practicing as social workers in the province. That is a pretty significant rate. And what that's going to do is, again, put some strain on the existing number of social workers that we have working in the sector. So 40% after 5 years is pretty significant. It varies across from year to year, but it's never below 50% after 5 years. So we also do some statistical analysis. This is duration analysis, this is proportional hazard model. And again, the idea here is so far we've presented descriptive statistics, but can we isolate and identify what the particular effects are, holding everything else constant? So can we isolate the effect of where you're registered, what your language is, are you practicing or not, where you're born, holding all the other factors constant? So that's our regression analysis. And so again, the way to interpret these hazard ratios is a number that's bigger than 1 means you're more likely to leave. A number that's less than 1 means you're less likely to leave. So we look at what's significant. This is not surprising. You can be registered as a social worker but not practicing. So if you're not practicing, you are much more likely to leave, which is not surprising because you might be registered for a year as you're thinking about your options or you're looking at transition, and then you cease to be registered after that. Language doesn't make much difference. There's some difference by gender. If you are, and this is holding other things constant, if you are newly registered, you're less likely to leave than if you are renewing your registration or and also similarly if you registered from another province. So you moved to New Brunswick, you registered somewhere else, you're newly registered in New Brunswick, or you've come out of school and this is your first year ever being registered, you are much more likely to stick around, other things equal. We again see some variation by where the sector you're working in. And if you are born outside New Brunswick, then you are more likely to leave. So this is holding everything else constant. Where you were born matters. And I apologize, in the French set of slides, there's a typo. These are reversed. That this indicates that other things equal, if you're from outside of New Brunswick, then you're more likely to leave. And this creates these policy questions around, and we find this with our other work as well, is that where you're from matters. That seems to be a consistent theme if we're looking at graduate retention or occupational retention, where you're from matters. And that's useful information in designing policy. Okay, so that's the work for social workers, for registered nurses. Now I want to just very briefly talk about where we're going with this. And this is all, again, supported by PEDAL through our research agreement, where This is part of their mandate. It's about workforce recruitment, retention. And so the idea is that we've demonstrated that this can be done, the value and the power of linking data. We've already established data sharing agreements with 3 different regulatory authorities. So we've got this track record. Now, can we keep adding occupations? There's a long list of occupations. Most of them are health related, many of them are health related. So what are we doing continuing the work? We're wrapping up our initial results for paramedics, working with the Paramedics Association of New Brunswick. We're in discussions with the Optometry Association because there's discussion in New Brunswick around whether we should have an optometry school in New Brunswick. In order to help support that decision, we need to know about recruitment, retention, demand for optometrists in the province. So we're working on a data sharing agreement with them. The Department of Health itself has some regulatory data. So we're working with them to identify what those other regulatory data sets are. So I think med lab technicians, occupational therapists, and pharmacists. So we're exploring that with them through our data sharing agreements. We are bringing in that registry data for registered nurses. So this would be nurses if you're a registered nurse, wherever you are working in the province, nursing homes, clinics, somewhere else, hospitals, we can look at all of that. We can look at also, we're looking at movements across and between those different sectors because we know that RNs sometimes will move around in different sectors. Also, what you might be thinking about is all the effort that's going into setting up bridging programs to recognize for credential recognition, evaluation, and recognition. So we've got lots of people coming in to Canada, to New Brunswick, who are highly qualified. They've worked as physicians or social workers or occupational therapists or whatever the occupation is. And we need those pathways to have an efficient way to evaluate their credentials, to deem that they're equivalent to what we require in New Brunswick so they can work in those occupations safely. And so these what are called bridging programs are being set up. There's a number of them already in operation. What we can do when we get data on the bridging programs, and we've already got data on the bridging program from the CCNB on the pathways of registration from LPN to an RN designation, is we can help evaluate who's going into those bridging programs, who's completing those programs, and if you do complete those bridging programs, are you more likely to move into employment in the sector rather than leave to another province? So looking at credential recognition, bridging programs for international graduates, we're working with the Department of Health on some of that. And also, and here is that, as you may be aware, there's lots of attention on different ways to provide incentives for people either to move into employment or to stay in employment. Say the $10,000 nurses bonus. So RNs, they get $10,000 bonus. If you're like a retention bonus, if we get data on who received the retention bonus, then we can actually evaluate whether it made a difference. Did it actually make people more likely to stay, or was it just a transfer to people who were going to stay anyway? So with the ability to link education, employment, registration, and Medicare data, we can actually bring some evidence to bear on these policy decisions and then lead to better policy and practice as we move forward, because we know this is a critical area, and we're going to keep adding occupations, keep doing these reports in conjunction with our government partners. So that is the last slide. There's our website, my personal contact details. Feel free to email me if you want to talk about anything.